Okay, well, hi everyone. I have a special guest to introduce, um, Professor Eli Summer. I did say that right? Eli Summer?
That's how Americans pronounce my name, but I pronounce it Ellie.
Ellie.
Yes,
Okay.
yes,
Okay, Professor Ellie Summer.
correct.
I actually found his videos when I was looking up maladaptive daydreaming, and I found out, to my surprise, that he was actually the man who coined the phrase maladaptive daydreaming, and I was all impressed, really. And you wrote the first paper about maladaptive daydreaming, is that right?
That's correct. And later, two other papers appeared. Now I'm involved in extensive research, and I hope that we'll be able to establish this as a disorder or a clinical phenomena that deserves attention of the scientific and the clinical community.
Oh, perfect. Okay, so I'm going to get to the questions that I had for you.
All right.
So the first one was when you first heard clients talking about their intense daydreams, did you actually wonder if it was another known diagnosis like schizophrenia? I ask because some with maladaptive daydreaming have been diagnosed as schizophrenic.
Right. No, I think that the disorder has, maladaptive daydreaming has only superficial resemblance to schizophrenia, but is not nothing like it at all. Schizophrenics are people who have a mental illness that creates changes in the brain and is genetic, and it causes them uh, to involuntarily hear bizarre voices that they don't want to hear. They are emotionally flat usually. They have problems with initiative, getting up in the morning, taking care of themselves. They have odd thinking, odd speech. Um, so this has really very little to do with daydreaming. And I think the reason why some professionals might have mistaken maladaptive daydreaming for schizophrenia is because folks who fantasize intensively and vividly sometimes report that they can really see things and feel things as if they were real. And that it is so compelling that it actually feels like a sensory experience
Mm.
that creates feelings and so on, and they move. And so I think that some mental health professionals perhaps mistook these kind of reports as representing hallucinations, which they are not, because although maladaptive daydreaming can be extremely sort of addictive in its attraction, to summarize, I think I understand why some professionals who have never heard about this kind of intensive daydreaming were mistaking these reports of very vivid imaginings, mistaking them and confusing them with hallucinations. But it has nothing to do with schizophrenia.
Okay. Okay. And I think my second question has basically been answered. What would you tell suggested professionals diagnosed in maladaptive daydreaming to tell the difference between this and schizophrenia or other conditions? Did you have something to add, or is that pretty much answered?
Well, yes, all sorts of. Let me turn my phone off. Well, there are several disorders that people get diagnosed for instead of maladaptive daydreaming. Uh, some people report that they have trouble concentrating and that they are restless because of the movement element in maladaptive daydreaming. So some clinicians see that perhaps as a manifestation of attention deficit disorder and hyperactivity, so it gets diagnosed as that. Some people emphasize in their report to their clinicians that they feel compelled to daydream, and it's a drive that they find hard to control, And that is then interpreted as perhaps obsessive compulsive disorder and is treated as such. Um, Others report, alongside the intense fantasizing, others report their associated social problems like shyness and social anxiety and so on. So they get treated for for their anxiety disorder. And the first group of patients that I diagnosed were all survivors of childhood adversity, and they developed this capacity to get absorbed in their own minds just to get away from the pain of their childhood. So I initially thought it's some sort of a dissociative disorder because it has to do with this intense absorption. It's like a state of hypnosis.
Mm-hmm.
And our current research, which we haven't published yet, indicates that maladaptive daydreaming is strongly associated with absorption, with the capacity to be completely absorbed into and focused on something, to the exclusion of other stimuli. So it has some components of dissociative disorder. But as I told you, it also resembles several others mental health issues, and we're still in our first steps of trying to understand this.
Kind of like with Tourette's, where it has the one main thing, but then it has all these other things around it.
I think that there are several pathways leading to maladaptive daydreaming. Some people daydream intensively just because they can. Because it's a gift, it's a talent.
It is.
That not
can be.
Yeah, I don't have it, and I sometimes I wish I had. So some people daydream a lot because they tell me it's great fun. Others daydream because it's a nice alternative to the hardships of life, past or current, and still others feel like it's nice to imagine so vividly an idealized self, and while their self-esteem is quite low. So there are different pathways leading to it, but the common denominator to all different forms of maladaptive daydreaming is the ability to do it. It's an ability that only some people have it, and people use it. According to their life circumstances. Sometimes just to play a fun video in which they are superheroes in their mind, and others just to soothe themselves.
Mm-hmm. Makes sense.
Mm-hmm.
Okay, well, here we covered this a little bit. What do you feel are the main causes of someone developing maladaptive daydreaming?
All right, so to my mind, it starts with the capacity that some people have and many don't. And then I think it is so rewarding, so tell me the people who daydream extensively, that it has an addictive capacity. So one cause would be the tendency to towards addictions. And that's not necessarily, anything good can become, when exercised excessively, can become addictive. Everybody can enjoy a good glass of wine, but having a bottle every day, is too much. And sometimes you need to drink a lot just to get away from your troubles. So the ability, and then we talked about the addictive capacity, and then of course the third main drive to do it is the ability to cover up and sort of control emotional pain and distract from internal or external difficulties. That could be either memories or intense psychological conflicts or lack of social skills. So there are probably more than one cause that could lead to that. Interestingly, I just came across two research papers of child neurologists, and they report about they call it stereotypic movement disorder. And apparently some parents identify that their children engage in repetitive movement. They rock or they pace back and forth, and they're concerned a little bit about this odd behavior, and they bring their children to the doctors. Then they're referred to specialists, to neurologists, and it seems that these children report that while they do this, what is called stereotypic movement disorder, they fantasize intensely. So these two papers, I think, are reporting about the same problem identified by the parents who observe their children being totally absorbed in their world and rocking and moving back and forth. And so this is sort of the observable aspect of daydreaming. A lot of people report that they pace or move or rock. So some of the parents identify that, bring this to the attention of clinicians. It's identified as a movement disorder, but the report in the literature is that this movement disorder is associated with intense imagery. So we might be talking about the same issue.
Okay. Wow.
Yeah. So I might get in touch with these folks and see if we can collaborate on some research. Although, my focus is on adults, but I've interviewed one child with the permission of the parents. The parents suggested that I interview the child, and they showed me some videos of that child. And it looks odd. And I know adults who do it very privately because they are a little bashful about their behavior. So they hide it, so nobody knows. But children, of course, they're very naive, so they do it while they play, and it's identified by their parents. So it's probably the same thing.
How common is it a person to act out their daydreams, and why do you think they do this?
Well, I don't know what you mean by acting out. What people tell me when I talk to people with maladaptive daydreaming, they tell me that sometimes they talk out loud their conversation. Mm-hmm. If they're concerned about being heard, they whisper it, but that's the extent that it's acted out. So people tell me that when emotionally compelling interactions happen, they can weep or laugh or be sad.
Yes.
So I don't know if you refer to that, but that's the extent of acting the daydreaming out. But they are all very aware that it might look odd to the onlooker, and they hide it. So people mm-hmm. prefer to do it in their own privacy. And so that they're not like they're acting it out on the street. I know if that's what you meant.
Well, in my case, when I was doing it years ago, at work, let's say I was mopping, I would incorporate the fact that I was mopping into the daydream.
Yeah.
Or if I would wiping down the table, I was just walking down the street, I would incorporate walking down the street into the daydream.
I see. Okay. Yeah. Okay. Yeah, but that's not actually acting out the daydreaming. It's trying to incorporate real life into the fantasy, and also pay attention to what you described. You said it's mostly associated with movement, because movement is for some reason very important. So mopping or walking it activates or maintains this internal absorption. And it's nice if you can incorporate it so it feels really real.
Yeah.
Actually, but I think that, you could tell if you care to on this interview. Most people I talk to, in fact all of them, have a dual awareness because they are aware of the external reality.
Yes.
So if somebody would engage with them or talk to them or stop them, they would immediately snap out of their daydream. So, and that's another difference between that and psychosis, because people that are psychotic and schizophrenic and they have hallucinations, they cannot snap out of it.
Mm-hmm. No.
No, and they would really believe that the external world is really, and their hallucinations are out there and that they're real.
Yeah. I always was able to tell the difference between fantasy and reality. Question number 5. When a client talks to you about their maladaptive daydreaming, are you often the first person they tell? That's because there's a lot of secrecy behind the condition, as I ask.
Often it is. Some of the people who talk to me about it and write to me about it tell me that when they try to talk to their doctor about it, few have, it gets dismissed. It's not being taken seriously. It gets dismissed. People are being told, look, it's normal, everybody daydreams, don't worry about it. Or, alternative, I mean, and that's the other extreme reaction, it gets misdiagnosed. Mm-hmm. As you started our conversation with the concern that this may get diagnosed as schizophrenia, for example. So some have tried to, but because there's little knowledge about it, it's misunderstood, so they don't talk about it anymore. But most are really bashful about it, embarrassed about it. Many are concerned that they are crazy. They feel that they are really odd, and many believe that they are the only one in the world who have this problem. You know, until they Google the right keywords, and then they come across this many websites, such as your YouTube channel, who has many videos on related issues.
Mm-hmm. Okay. Really sorry about the vacuuming upstairs. I think you can hear that, right? It's not cool.
Slightly.
Slightly?
Yeah.
Okay. What do you feel makes this condition maladaptive, and that it can't be said that it's a normal, like, say, condition?
Mm-hmm. Well, I suggest that we look at the same criteria that we apply to other disorders. So, you know, anything can be, any trait can be put on a spectrum from normal to abnormal. For example, we all have sometimes sadness, and we would not call ourselves pathologically depressed if we are abandoned by a lover, if we fail a test, if we lost something that is important to us. You know, so it's normal to have occasional feelings of you know, the blues. But if one cannot bounce out of a bad feeling for days and weeks and months, then we are concerned, and when it interferes with their functioning. So I would suggest that we apply the same criteria to maladaptive daydreaming. It is a wonderful trait to have, and I wish I had it, this capacity. So maladaptive daydreaming can be regarded as pathological when it consumes too many hours of waking hours, when the individual is unable to work properly, when it gets in the way of social life, when people prefer their imagined social life to the effort and the threat of engaging with real people, when it interferes with concentration and creates problems in school work, in academic work, and when it associated with distress. So when people are suffering from it, they do want to quit, but they can't. Makes them feel crazy. It makes them. It discourages them because they don't see a way out of it. So all of these factors can, justify the classification of daydreaming as a problem, as maladaptive. Alternatively, when people can do it upon will, they're in complete control of it, can go days without it, but sometimes like to have a good fantasy for 2 or 3 hours. I mean, that's like having a video on demand in between your ears. Only it's better than video because it feels real. Video is just two-dimensional. This is like virtual reality. So it can be a nice, wonderful trait to have, but when used excessively and feels like an addiction, and when it has a life of its own, then many people feel distress, and indeed people are online are asking for help, and we don't know yet exactly what is the best way to help. And I know this was probably your final question, wasn't it?
Yeah. The best way to help, what do you recommend as treatment for those who want help for their daydreams?
Well, again, this is not based on any research yet. So the best and most accurate and most responsible answer would be we don't know.
Okay.
But if you ask me to guess and to sort of where would I start, because I do work with some people who have maladaptive daydreaming, I would say that it is very important to understand the underlying causes and if there are any. Because and indicated earlier, that could be early childhood trauma, that could be a propensity to get addicted as a distraction from life and from the problems of life. If it is a compensation for inadequate social skills. So, these need to be identified. If they exist, they need to be treated first to give people the skills they need to cope with the challenges in their life. And on top of that, I think people need to learn ways to anchor themselves in the here and now. By mindfulness techniques, by all techniques that are sort of adopting behaviors that are incompatible with daydreaming. And so that's very behavioral. For example, call somebody if you need to, if engaging in conversation with another person helps you stop it and call a friend or talk to somebody. Take a shower, go out jogging if this kind of movement is not a trigger. Do something that requires your attention resources rather than something that is automatic. Sometimes people, when they do a boring chore like mopping or doing the dishes, they will drift away because it's automatic. It doesn't really require any attention resources. So do something that requires your attention. So you need to be very careful. These are some ideas, and also avoid the triggers. If you know that certain kind of music will throw you off, and you really want to be in control of your daydreaming, then you would want to control that. The cue, the trigger that sets you off. So these are some initial ideas. The latter group of suggestions are very behavioral, but often we would have to go, as I said, deeper to the deeper causes. So I see in my mind some sort of a package deal of these two type of treatments. And of course, we have some evidence, very preliminary evidence, and there's been one case study published on this, that some people who have had completely normal childhoods and they daydream a lot, maladaptively, some of those people may respond to medication that is designed for obsessive compulsive disorder. So that's another avenue to explore. But as I said, we are in an embryonic stages of knowledge and research. But thanks to people like yourself and others who are really committed to improve awareness about this, I'm confident that we're moving along and we'll get this problem recognized properly. And I've already presented it in two professional conferences, and there are two papers that we are about to submit soon in Good Scientific Papers. So the grassroots efforts like you are engaging in, and my efforts as a scientist, I think will get this disorder on the map. We'll put it on the map.
Right. And good, because people need to know that this exists, because they feel so like, oh, no one else does this, I'm sure. So it's kind of a great thing to have out there.
Right. Okay.
Okay, so thank you very much for talking with me, with us. You guys can see Professor Ellie Summers' channel. I'm going to put it in the description, and I also plan on putting it at the beginning of the video in the video. So if you didn't click then you can click in the description to see what he has to offer. And about half of them, not even half, are in English, right?
Right, right. And I'm not. I don't have too many videos, but about 3 or 4 are about maladaptive daydreaming. And when I have more to say about it, I will.
Okay, cool.
All right.
Well, thank you very much.
You're most welcome.